I'm DrShazeema Shaw. I work at GPHC. I have a master's in internal medicine and infectious diseases.
Tell me about your work in the COVID-19 unit.
So right now my task in the COVID-19 unit is sort of organizing everything that happens organizing things that happen with GPHC. This includes the flow when a patient comes in, to do the reviews at the triage gate. So we have a screening and triage gates on East Street. So if the doctors that see you there have a concern, I would review those patients. I would also assist with the swabbing of the patients. So if you come, we make an appointment, we have you swabbed. I also assist with the quarantine unit. So we have an isolation quarantine unit for our very sick patients. I also coordinate the stuff for that unit as well. A few other minor stuff, and I'm on the task force for GPHC.
Right. Tell me how challenging your work is, if it's challenging at all.
It is challenging. Reasons for it being challenging, it's something new. We've not experienced such a pandemic before in Guyana. And with it being new, there are new challenges with respect to how things flow. We didn't have a lot of policies and protocols to do things. So it's basically figuring things out on a daily basis, on a case-by-case basis. We are more in keeping with the flow currently because we've had a few cases before, but challenges do come up all the time.
Tell me a bit about the unit itself. How many doctors do you have? You have nurses, that kind of thing?
Yeah, so currently on our isolation unit, so it's the isolation intensive care unit. It's a part that is sealed off from the rest of Georgetown Hospital, and that's because of how contagious COVID-19 is. So it's sealed off. It's where we house our very sick patients that require ICU care. So these patients would need to be on a ventilator, that's the machine that breathes for you, etc. Currently, we have 3 teams of doctors. Each team has 4 doctors that work on that team. So there's a senior, sometimes 2 seniors, and you have 2 juniors that would assist as well. We have nurses, depending on the workload. We can have 3 nurses in, 2 nurses in, etc. So in total, we have about 25 staff.
Yeah. So Dr. Shaw, there is no cure for COVID-19 at this point. There is no vaccine. Explain to people how you go about treating someone who tests positive.
So if someone tests positive for COVID-19, whether it's mild disease or it's a complicated disease, it's very much of a symptomatic treatment, meaning if you're having problems breathing, we try to address that. Whatever issues come up, we try to address. However, there are trials of using a few medications that we have started to use on our patients here. They were approved in some countries, but there's still controversy. Lowever, we've chosen to use those medications for the benefit of our patients.
Those are the malaria treatment?
Correct. So those are the hydroxychloroquine and the chloroquine that we've started, as well as the azithromycin.
Of course, the unit is not big, and so the hospital has been advising people not to come to the hospital. When should someone come to this hospital?
Yeah, so if you're experiencing respiratory symptoms and you call the hotline and they tell you to stay home and isolate, you can follow those once you're still comfortable at home. The minute you become uncomfortable, can't breathe properly, or having any other issues or worsening issues, you can come to our East Street triage area where we see you, you're evaluated by a doctor. You can either be cleared to enter the emergency room if we think it's not COVID. If we think it's COVID, we bring you back to test you, or we have a tent hospital set up where we can house you for that period of waiting on the test results and then decide what we do next.
So if people at home show symptoms, what can they do instead of coming to the hospital?
So if people at home have very mild symptoms, they can call the hotline so that they can be tested. And they should stay at home initially because you don't want people with symptoms coming out to infect others. If, however, their symptoms are worsening, they should come out to seek medical attention.
And we've been hearing different stories about stigma and discrimination against healthcare workers at this time. Have you heard some of that from persons working in the unit, the doctors and the nurses?
Yeah, so the nurses are saying it's very challenging working in the unit, especially the nurses that don't drive. That's because they need to have public transportation, etc. So it is challenging because taxis don't come to the hospital anymore. A few services have not been coming. So they have those challenges. As well as now with the curfew, they're a bit challenging to get home. I mean, for the nurses that work after 6. So we're hoping to put measures in place to address those.
But have they said that persons have been helping? Because I know in other areas, like on the West Coast, there are persons volunteering to drop off healthcare workers. Have you had those stories here?
Unfortunately, I've not heard of any.
Well, hopefully that will change.
Yes.
Yeah. Thank you very much, Dr. Shaw.
You're most welcome.